Hi guys and welcome back. In this particular presentation we're going to be taking a look at medication, specifically with over-the-counter and prescription medications. So I just want to point out before we move on, I would never ever advocate the taking of medication to encourage sleep. Again, I'm not a doctor, however the research that I've done on this subject leads me to believe that these drugs are extremely powerful, but they also have a high potential for dependency as well. So natural is always better when you're trying to overcome a problem. So let's take a look at some drugs and medication that affect sleep and how they do that, and we'll start with some everyday ones. So antihistamines, cold, cough medicines, things like that. Now these cause drowsiness and sleepiness, and that obviously will upset your circadian rhythm. They often also contain alcohol, and that will affect your REM sleep, stage 4 of your sleep. Other pain relief things like ibuprofen and paracetamols, these contain a lot of caffeine. Now a lot of people also take these at night to try and get a good night's sleep, but because they've got caffeine in, it has the opposite effect. So getting away from the day-to-day ones then, let's take a look at some drugs and medications given to help with more significant health issues and how they affect sleep. So A and B blockers, a lot of people are on these. They're taken for conditions such as high blood pressure, Raynaud's disease, angina and glaucoma. Now these are linked heavily to decreased REM sleep, memory problems, awakeness at night and nightmares. These drugs tend to inhibit nighttime production of melatonin, obviously not conducive to a good night's sleep. One of my favourites, antidepressants. Now these drugs almost warrant a presentation in their own right. Now most of them work by blocking the reabsorption of serotonin, our happy hormone. So you're trying to take something to stop you getting depressed, but you're suppressing serotonin, your happy hormone. Work that one out. So the list of side effects for these drugs is also staggering, but some of the most common include insomnia, agitation, tremors, and my favourite, anxiety. Yes, a colleague of mine was on antidepressants. I looked at the side of the box and it said may cause anxiety. Work that one out as well. So moving on. Another one is statins, a very popular drug these days, taken to control high cholesterol. So the main reported side effect is muscle pain, which obviously is going to affect sleep. During this research, I was staggered to find out how many people are on statins have also been prescribed sleeping tablets. Corticosteroids, so C steroids, these are taken for things like arthritis, inflammation and gout, etc. These actually wreak havoc with your adrenal glands, which obviously regulate your fight or flight response. So this in turn stresses out all the systems that allow you to sleep and relax properly. So there's lots of other drugs obviously. I just thought I would try to give you a flavour of what's out there and how they will affect your sleep. So again, a disclaimer, I'm not a doctor. I never have been and never will be. This slide and course material is not medical advice and shouldn't be taken as such. And I'm not advising you not to see a doctor if you feel you need to, and I'm not suggesting you ignore doctor's advice either. All I'm suggesting is you try and exhaust all avenues of natural, holistic, homeopathic treatments and remedies you can before thinking about drugs and medications. All the answers are within this course material. So basically there are some very easy steps to follow. The first one is to keep food and water as clean, natural, unprocessed and or organic as you possibly can. The second is incorporate exercise into your lifestyle. The third is remove stress as best you can and practice some sort of relaxation exercises. And the last one is keep of a positive mindset. All these will keep you natural and off medications. So the next presentation on this section we're going to be looking at is pre-sleep routine. Okay, thanks for listening. I'll catch you then. Bye bye for now.